Theory and Practice of Counseling and Psychotherapy, 10th edition. Chapter 11, Choice Theory, Reality Therapy. Introduction. Glasser limits the term mental illness. Choice therapy is theoretical basis for reality therapy. Reality therapy provides a delivery system for helping individuals take more effective control of their lives. View of human nature. Internally motivated behavior is geared toward meeting one or more of our basic genetically encoded needs: survival, love and belonging, power, freedom, fun. Our quality world consists of our visions of specific people, activities, events, beliefs, and situations that will fulfill our needs. Our quality world is like a picture album of specific wants as well as precise ways to satisfy these wants. Getting into the client's quality world is the art of therapy. Choice theory explanation of behavior. We often mistakenly choose misery in our best attempt to meet our needs. Symptoms are the result of choices we've made. We can choose to think, feel, and behave differently. Reality therapy is based on choice theory. The emphasis is on personal responsibility. Doing are active behaviors. Thinking are thoughts and self-statements. Feelings, anger, joy, anxiety. Physiology, bodily reactions. Characteristics of reality therapists. They emphasize choice and responsibility, reject transference, keep the therapy in the present, avoid focusing on symptoms, and challenge traditional views of mental illness. Cycle of counseling. Following are the two major components. Number 1, creating the counseling environment, which would be supportive, challenging, and non-coercive. Number 2, implementing specific procedures that lead to changes in behavior, such as WDEP. The WDEP system. Following are the procedures that lead to change. W, wants, needs, and perceptions. What do you want to be and do? D, direction and doing. What are you doing? Where do you want to go? E, self-evaluation. Does your present behavior have a reasonable chance of getting you what you want? And then P is planning, SAMIC 3. Planning and action. Webholding uses the acronym SAMIC to capture the essence of a good plan. S is for simple, A is for attainable, M is for measurable, I is for immediate and involved, C is controlled by the planner, committed to, and consistently done. Application to group counseling. Group provides opportunities for exploring ways to meet their needs. Members explore new courses of behavior that will bring them closer to getting what they want out of life. Leaders challenge members to evaluate for themselves if what they're doing currently is working for them. Feedback from the leaders and members can help individuals design realistic and attainable plans. Considerable time is devoted during the group sessions for developing and implementing plans. Group setting encourages members to take an active stance in shaping their own destiny. Strengths from a diversity perspective. Therapists demonstrate their respect for their clients' cultural values by helping them explore how satisfying their current behavior is to themselves and others. It is a sign of respect that the reality therapist refrains from deciding what behaviors should be changed, with a focus on thinking and acting rather than on exploring feelings. Many clients are less likely to display resistance. The principles underlying choice theory are universal, which makes choice theory applicable to all people. Reality therapy is an open system that allows for flexibility and application based on the needs of culturally diverse individuals. Principles and concepts can be incorporated in a dynamic and personal way, and there's a basis for integrating these concepts with most of the other therapeutic approaches. Shortcomings from a diversity perspective. Reality therapy gives only limited attention to helping people address environmental and social problems. Some reality therapists may not pay enough attention to systemic and environmental factors that can limit the potential for choice. Some clients are very reluctant to directly verbally express what they need. Contributions of choice theory, reality therapy. Reality therapy has a relatively short-term focus and deals with conscious behavioral problems. The existential underpinnings of choice theory are a major strength of this approach, which accentuates taking responsibility for what we are doing. With the emphasis on responsibility and choice, individuals can acquire a sense of self-direction and empowerment. Reality therapy can be effectively used with individuals who manifest reluctance and ambivalence to change. Reality therapy has been effectively used in addiction treatment and recovery programs for over 30 years. Limitations and criticisms of reality therapy. Some feel reality therapy does not give adequate emphasis to psychological concepts such as insight, the unconscious, dreams, and transference. More empirical support of reality therapy is needed. Recall, report, share, and relive the dreams can pave the way for clients to take a different course of action. Some therapists may impose personal views on clients by deciding for them what constitutes responsible behavior. Reality therapy appears to be easy to implement. Effective practice of reality therapy requires practice, supervision, and continuous learning.